Great. Thank you.
I'll try not to keep you any longer than I have to here. Feel free to ask questions as I'm moving through my presentation here. So,
Sergio, please definitely take your time. We have an hour. I didn't mean to rush. I don't mean that towards rushing you.
No, I know. I'm sure people are desperate to get off the phone who've been on since this morning. But all right, so let me roll into this. I was sent invitations by the state with regards to the sheltering task force pretty early on. I really wasn't aware what the sheltering task force was going to be because I was receiving so many invitations to other presentations at the same time. So I missed the first one, but after reading the initial minutes from the first meeting that DHS was holding, I figured it would probably be beneficial for me to jump on and see what was going on around the state with all the state funding and also the potential federal funding at that time coming down to the state. After my first initial meeting there, I decided to have a pretty frank discussion with our director of social services here in Blair County, basically letting him know exactly what we were dealing with as far as the amount of households that were on the community queue for Blair County. Even though we work very closely with his office because they're the actual applicants for HAP and ESG and CSBG, they never really get a full scope of how many people we actually have on the community queue on a day-to-day basis. So as I started to share the information from the meeting and the sheltering task force meeting and also what we were dealing here locally, he really got a better picture of what is the level of need we had here in Blair County. So at that time, we were looking at about 140 households that were on the community queue just in Blair County. And if we would have been unfortunate enough to have an explosion of positive cases of COVID-19 or hospitalizations, of course, everybody knows that that population is extremely vulnerable to not only getting contaminated, but also cross-contaminating other people that are homeless or anyone they come in contact in the community. So as we started to figure out how we were going to move forward, we basically agreed to start having meetings twice a week and start bringing in other stakeholders. And of course, more people were participating in the sheltering task force meetings here in Blair County. So as we, I think there's some background noise back there. As we started to clean up our community queue here in Blair County, basically figuring out exactly how many of those individuals that were still sitting on the community queue after March 16th were actually still in need. They weren't in the shelter or they hadn't been housed in any other way or put into any other kind of temporary housing. We still saw that there was over 130 households, and that, of course, ended up being the number that we started to move forward with. He also has access, and this is the director of social services here in Blair County, also has access to the Affordable Housing Fund, Act 137, I believe it is, in the county. So he has a regular advisory board that he convenes with every other month, basically to run projects with that they're going to use the Affordable Housing Fund to basically address other needs in the county. So he saw this as something that he could easily have access to just by putting together a request for his steering committee, advisory committee, to make a request to the commissioners. The committee convened on an emergency basis. Then they pushed that request up to the commissioners, which they passed at an emergency meeting also. So we had access pretty early on to $50,000 that we were able to use to start placing people into hotels. The bigger problem came when, and it was mentioned on the call earlier, is finding hotels that were willing to work with us and our population. We had several that instantly jumped on it. We were looking to do 30-day stays, finding hotels that were willing to work with us in an agreement type of situation to hopefully give us anything better than what their nightly rate was, which was averaging out to be about $49, $50 a night, which took that amount to something that we really didn't want to be forking out every night. We found some hotels that were willing to do a 30-day stay at a considerable savings. I think right around the $650 to $750 range is where we ended up with the hotels that were giving us the best price. We were also looking for hotels that were in the closest proximity to other amenities, food, of course, and public transportation where possible, not as far away from the hospital if need be. We also started working with the Director of Emergency Management through this task force, who was able to bring the resource of where they were going to be sheltering people that had either been tested for COVID-19 or needed to be quarantined, but were still asymptomatic. So they had been working with several of the hotels in the area. Unfortunately, some of them were the hotels that we were also asking for assistance in housing the population that we were working with. They had already designated one of the bigger hotels that is also attached to a convention center here in the county for the potential of having to set up a field hospital and house medical personnel. They also had a agreement with one of the local hotels to be their quarantine site, which was great because later we did have one individual who became homeless after she was tested and was advised not to return to her home. So we easily contacted him. He gave us the name of the hotel, and we moved that individual without any problem into that hotel. So some of the things that we did very early on to help us stretch our dollars out, of course, were to try and negotiate longer rates with some of these hotels that were going to allow us to have people off the streets for extended periods of time, especially those that are considered to be extremely vulnerable to the virus. The other thing that we did is, as soon as we got the waiver notification from HUD, we put together our waiver request and it in the same day, and we asked for every waiver that was available through to the COC contractors, except for the permanent supportive housing one. So that has actually allowed us to expedite our move-in through our rapid rehousing funding, which has shortened the length of stay of individuals that are being put up in hotels and allows us to move other individuals that we have in the queue into those hotels. Like I was saying earlier, the biggest problem we've had is finding rooms available that are still reasonable and are willing to work with the population that we're working with and that are willing to give us 30-day stays versus a nightly rate or a weekly rate. which pretty much doubles the highest amount that we're paying at this point in time. We've been working with the county. Like I said, social services is the one that applies for HAP and applies for ESG. We've asked to modify our allocation to allow us to do shelter operations, which will allow us to place more individuals into hotels. We've also asked to modify our HAP funding to allow us to be able to provide other services to those individuals that we'd be placing into hotels. We will be applying for CDBG funding through the city of Altoona to allow us to do both hotel stays and food. So when it came to food, we saw early on that it was going to be one of the big needs that one of the big potential needs that anybody we put into a hotel would probably end up needing. So we started working on that and finding different resources that we were either going to be able to refer people to or allow us to pick up food and deliver it to the people that we had in hotels. So through a combination of private donations, coordinating with our local food banks and our soup kitchens, we've been able to, and of course, we have transportation available through some of our funding here. So we've been able to basically coordinate all of that and provide food on a daily basis when necessary to anybody who is requesting it that we've housed in a hotel. Landlords, we actually put together a press release a few weeks ago for the local Altoona Mirror that goes throughout the county, basically explaining what we were doing, why we were doing it, and then just putting out a request for any type of donation that could help us either with the housing or the feeding of the individuals that we were putting up in hotels. We requested any help from landlords that were willing to work with us on a 30-day basis. Of course, we've received several landlords that have volunteered their properties that they had available in order for us to move families in. Right now, we've taken advantage of some of those offers and moved the families that we could out of the hotels into a more permanent situation using some of our rapid rehousing, both under the COC and opioid use disorder funding that we have through DHS. So, like I said, we'll be going through the ESG application process, the CDBG. We've asked for modifications to our HAP, and we've requested all the waivers that we could through HUD. At this point in time, we're continuing to work through the community queue. We're making calls out to pretty much everybody that we can on a daily basis, seeing if any of them their statuses have changed, looking to see if somebody on the community queue has actually either been tested for COVID or has been advised to self-quarantine or has been given some other instructions by a medical professional to self-isolate. So if that happens, we push them to the top of the list and move them to, we'll be moving them to that quarantine site that the county EMA director has already set up. We, like I said, are meeting on a regular basis with the stakeholders in the county. That is the family services that operates the family shelter, county staff, EMA staff, representatives from the Landlords Association, representatives from the organizations that serve people with disabilities. And I think we have a pretty decent task force put together, and we stood that up pretty early on. And I think it has led to a lot of the success that we've had being able to move people off the streets as quickly as we can. Any questions?
Sergio, this is Lee. I have a couple questions. You indicated that you guys are coordinating with the Emergency Management Agency. Have you been able to, or has your county, I guess, been able to secure any funding through PEMA as part of that coordination?
The short answer is no. We put together a request and submitted it to the Director of Emergency Management here in Blair County. You know, he was in on the meetings pretty early on, so he understood what the need was going to be. We tried to narrow it down to what is Category B under the FEMA directives, and the request got denied. Basically, they said, and I don't know if you were in on the sheltering call where Jim Hudak was asking FEMA exactly why it was denied. And they basically said that at this point in time, FEMA was not willing to shelter anybody other than those that had been tested or ordered to quarantine, that they would not be, they did not have the resources and weren't looking to provide funding for anybody outside of that category.
Yeah, I was not on that call, but that mirrors my experience in conversations with PEMA to date. So if you somehow had a way of accessing that information, or those resources, I should say, I thought it would be good for you to have an opportunity to share it with everybody. Because
we've attempted several times, and unfortunately the response is that FEMA will not be asking FEMA for additional funding because the state does not have the ability to match that 25% requirement that FEMA requires in order to fund any of the reimbursements that they're going to be doing. So I think it was a presentation from the National Alliance to End Homelessness. They had some presenters from the West Coast that were basically saying, your county doesn't necessarily, or your local government doesn't necessarily need to go through PEMA. They can make a request directly to FEMA, but there has to be certain things that are in place, such as what was the declaration, the declaration, the health declaration, or the declaration of need by a medical official at the county or the local level that basically states that the reason that you are trying to house the homeless or want to house the homeless is because it's a health issue. So Jim Hudak, who is in charge of the task force, because he's the director of social services, has asked for more guidance from both PEMA and FEMA on how the county could go ahead and get that declaration made and put together basically the request to FEMA at the county level. So that's where we're at right now.
that's great. If you guys are able to get that waiver request secured, please share that information with either folks in your, on these calls, or through our office, and we can distribute it because I think a lot of folks would benefit from having access to those resources.
Yeah, the big hurdle there, I think, for a lot of communities is going to be somebody that steps up like the county is doing here to provide that 25% match. So when Jim and I were talking about it after the presentation, he said, well, we still have money in that affordable housing fund, and I'm willing to put the county up for that 25%. So that is really what I see as the hurdle in having that conversation with people at the local level.
Yeah, I mean, I guess the part that I'm confused about is that without that coming up with that 25%, then the expectation is that you're coming up with 100%. So it's I feel like I'm missing some part of it, but this is certainly the conversation that I've had with folks to point that out. But I don't know. I'm just interested to see what happens in your situation with the county coming up as the match, and hopefully the rest of us can learn from that as well. The other question I had, and hopefully other folks on the call have questions as well, is you mentioned a couple times CDBG, which, by the way, I'm almost certain can also be a source for that 25% match. But I'm wondering, for folks who are not already coordinating with their local CDBG contact person, if there are any sort of thoughts or words of wisdom in terms of having a fast track relationship. I mean, it's much easier to come to somebody when you have a relationship to say, hey, buddy, let's talk about this new money. When you don't have that relationship, it's a little harder. And we know that new COVID-19 resources are going to be coming through CDBG. And I'm wondering if you could talk to folks about any suggestions that you would make if they don't already have a relationship with those providers.
So pretty much everything that has happened, as you just alluded to, is built on relationships that our organization has had, both at the county and the city level. The city is the administrator and the applicant of the CDBG that we're going to be submitting the application for. They, of course, did their mass distribution when they got the notification or the application for the CDBG. And we had already brought the director of the redevelopment authority into the task force, so he had a really good understanding of what we were doing and what we were hoping to do. So outside of that, I have been on several different committees with him also. So and he's asked me to do several things to help him out. So, the relationship was pretty tight already before all of this happened. And so it was easy for him to kind of have an understanding of who we were, what we were doing, what we were hoping to accomplish in the short run, and of course some of the other work that we have done throughout the county and the city. So my suggestion is, if you don't already know who your CDBG administrator is in the county, you may have more than one like we do. Contact them and see what they're going to be doing with their CDBG funds if they've already sent out the application. Our application isn't due to the city until the end of the month, but we're submitting ours either today or tomorrow. We've been working on it since last week. It's a very simple application. It's just a matter of getting your numbers together, really, and your plan together. It's not like previous ones. It's a very straightforward type of application.
Great, thanks. And go ahead. Sorry.
I think DCD can provide people with their contact person if they don't know who it is.
Sure, we can try to get that and make sure to make it available to folks. And for folks who weren't on the call, Don Enrico has been on one earlier call and has agreed to come back and share some additional information with us once the state has some more details related to the state's CDBG funding for those who don't get the funds directly from HUD. Anybody else have questions for Sergio? Are other folks setting up a task force in their community to ensure that there's a lot of collaboration happening with folks who have access to different resources? If you're on the phone versus the computer and you want to speak, a couple things. One is that if you hit *6, you should be able to unmute. One question that was asked by Bill is, and Lauren just, I haven't read that, but Clearfield Jefferson, they have a hotel that is located near services, and they would like to use it for a temporary shelter, but the owner insists that our office would be liable for any damages the guests incur while there. Do you know if that's standard practice everywhere? I haven't read Lauren's email or response yet. I do know that I've heard about cleaning and damage in other communities. Sergio, is that something that you can speak to, since you guys are contracting for quite a number of hotel rooms, and if it is, how you've negotiated that to be a workable situation?
Yes. So that was some of the concern with some of the hotels as far as who was going to be responsible for the damages. We put together a agreement that we have everybody. The other one that no one mentioned was what happens at the end of the 30 days for the state. Are we going to have to deal with squatters? People trying to assert squatting rights. And I assured them that a hotel stay is a hotel stay. We're not putting people up in a house. When somebody stops paying on a hotel room, it's basically get out or get arrested. It's not one of these, now I've established residence here and, the law is on my side. Not as cut and dry with landlords, which brought up that same concern. And that's one of the reasons that we're trying to move people that are ready to move into our rapid rehousing program, into those landlords taking up those offers to house people in longer term type of situations rather than this short term. We put together an agreement specifically for these hotel stays that everybody understands that this is not in any way, shape, or form a permanent type of situation, that it is short term for the duration of this emergency and not to be used in any way, shape, or form as a permanent type of situation. Any potential damages to the property, we don't really have anything worked out with the hotels, but we did have one individual who decided that they were going to damage a room after the hotel kicked them out because they saw them dealing drugs on the property and basically didn't want them there anymore. The individual decided to cut all the extension cords on all the appliances and lights in the room. We took it out of that same funding that the county has provided us, and that's kind of where we've left it.
Any other folks want to share their experience with Bill and how potentially they've been able to structure agreements with hotels? Okay.
Sergio, I'm curious, I think you mentioned maybe there's some hotels, motel. Maybe you didn't. I could be thinking of, there's so many calls today. I've been hearing more frequently folks reaching out and sharing that hotels in their area don't want to work with them. And so I'm curious if you all came upon anyone who in the beginning wasn't interested in working with you all, and if you went through a process to persuade them otherwise, because I know that that is an issue that some folks are coming up against at this time.
So we initially tried to work with some of the owners that either us or some of the people that were on the task force had personal relationships with. And they themselves were butting up against their own management companies. And sometimes it was the owner, sometimes it was the management company that was dragging their feet or, saying, well, we've had so many issues, we want to know for sure who's going to take care of any damages. If you guys can't, guarantee that you're going to take care of damages, then it's going to be hard for us to work with you. And we were kind of going at it from two different fronts, where we had a staff person calling around and just getting the information on the hotels, what their rates were, if they were willing to work with us on a 30-day agreement basis, 30-day stay. And at the local level, it seemed to work a little bit better when we were just making the calls and talking to the front desk staff and the managers than it did trying to go through the owners. We did have some that came straight out and said, yeah, we won't work with you guys, but that was very few. The biggest hurdle has been this $49, $50 nightly rate, which is on a short-term stay that is inexpensive, but when you're talking about 30, 45 days, that gets to be quite a bit of money.
Thank you.
Any other questions for Sergio or for anybody else on the call, or suggestions of topics to be addressed on Thursday's call?
Can I ask a question?
Please.
Is there anybody that has COC funding that has not applied for the waivers? And if so, why? And the main reason I'm asking is because it was a matter of hours on turnaround. We applied directly to Pittsburgh office, and I think I sent it about 4 o'clock in the afternoon, and by 6:45 I had received an answer there. As soon as we requested the waivers, we were approved.
Sergio, to piggyback on that comment, for folks on the call, so I know that Pittsburgh responded to you, and that's great that they responded. HUD has reiterated that as long as you notify them no less than 2 days before you intend on using a waiver, you don't have to wait to hear back from them. So if you reach out to HUD according to their notification process around using COC waivers, within 48 hours from your notification to them, you can start using it. So you may hear back from them, but if you don't, that doesn't mean that you aren't approved to do so, and they encourage everyone to keep moving forward 2 days after they notify HUD. So don't wait. If you don't hear from them, you can keep it moving.
Yeah, and that's going to be a lifesaver for those of you who work with the Philadelphia office, because you likely already know that you have never gotten a response within 48 hours of anything. I think thanks for reminding folks of that, Lauren.
Yeah, I think the biggest help that we received through the waivers is being able to go outside of fair market rate. I knew that was a hurdle we had here even before this started, and to be able to just go with rent reasonableness has opened up the entire market for us.
That's great. Okay, well, thanks to everybody for participating today. Sergio, thanks so much for talking to us about your experience there in Blair County. It sounds like you guys are really coming together in a very productive and meaningful way to get folks housed and to keep folks safe. And good job with that. As indicated today, for those of you who participated in the Eastern PACOC meeting, we're going to be getting a survey out hopefully in the next 24 hours, if not sooner, about needs to inform board discussion around the use of some funding that is being made available to the COC. I think I'm going to double check with the Western Executive Committee, but I think it will probably make sense to send the same email and survey over that way. So even if you're in the West and you're hearing this, please be on the lookout for a survey. And if you can start thinking about, where do we still have those gaps, whether they're big gaps or little gaps, specifically around costs that are not eligible through your existing funding sources. I think that's really how we can maximize some of the funding, this flexible funding. So please make sure you're spending some time thinking about that. All that being said, we also still have the portal to accept questions through for the office hours, and we can certainly work on addressing questions that we receive in advance, and hope that you all join us on Thursday. And if you have questions that come up or ideas or, again, information that you're looking for, please let us know, and we can weave that information into Thursday's call. Lauren, did you have anything else, or Sierra, or Brendan?
I don't have anything, Lee.
I'll just share, I posted it before but had to take it down because of HUD guidance. They asked us to remove it before sharing, but on the COVID-19 response page on Workplace, I did post 2 documents that can be used to help track the use of waivers. I would just recommend that everyone go and review that for your own use. This goes for COC and ESG funded programs.
And this is Lauren. I would say the only new question that we have a response to, and Sergio kind of covered this a little bit, is related to the eviction moratorium. So we'll post this on Workplace, but there was a question we received about the eviction moratorium and who is covered. So specifically people staying in extended stay hotels who are being evicted because they've lost their jobs and can no longer pay their agreed upon rate. So we'll be posting some guidance around that, just teasing out when someone who's been staying in an extended stay hotel kind of qualifies as a tenant and would fall under the eviction moratorium and be protected by that. It's a gray area, but generally it's if the hotel is their sole residence and if they've been staying there for a period of greater than 30 days and the room is, they have sole possession of it, etc. So we'll be posting that. But with regard to questions that have come in since the last time we posted it, that's the only one that we will be posting a response to. Everyone else has been kind of asking kind of nitty gritty in my community. This is what's happening. And so we're fleshing out and trying to provide as much guidance to folks as possible to be creative with funding. So just an update on a new Q&A that we'll be posting.
Great. All right. Thank you, everyone.
Thank you. Thanks, Sergio, for taking the time to present today. Take care.
Thanks, Sergio.
Thank you.
Thank you. Bye.